Good afternoon, everyone over here. Myself, Rita Anand, dietitian at SGPGI, working for gastroenterology, surgical gastroenterology, liver transplant, and hepatology since last 17 years. So here I'm going to talk about nutritional management for NAFLD. NAFLD is an umbrella term under which fatty liver, non-alcoholic fatty liver disease, sclerosis, and inflammatory diseases are coming. So this is a very broad spectrum, and the prevalence of NAFLD in general population all over, it's almost in 1999 it was all over world only 45 lakh population was reported, and in 2020 it almost 92 lakh population was reported for NAFLD. So it is almost in 2 decades the population suffering from NAFLD is almost double all over world. And in India, the 25 to 30% population is unknowingly and diagnosed is almost 25%. And this even in pediatric cases, 32% pediatric cases, reported cases in India are suffering from NAFLD. So symptoms are fatigue, pain or discomfort in the upper right abdomen, persistent nausea and vomiting, loss of appetite, possible signs and symptoms of NAS, and advanced scarring is included abdominal swelling, distension in large blood vessels, due to which hematemesis and occult blood can be seen in blood reports. Red palms, yellowing of skins and eyes, which is commonly known as jaundice. So causes of non-alcoholic fatty liver disease is genetic factor, insulin resistance, poor diet. This Swiggy and Zomato is the major cause of this NAFLD these days. Chronic infection and other viral marker like hepatitis A, B, C. Basically B and C is more responsible. Uses of certain medications, sedentary lifestyle, high environmental toxins exposure, chronic alcohol abuse. Category of NAFLD. NAFLD can be separated in 2 categories. Basically, more than 5% fat, more than 5% fat present in the liver is known as fatty liver, where fibrosis can be seen or it may be present or not present. NAFLD is simple steatosis, the presence of fat in liver with or with no little inflammation or scarring. Non-alcoholic steatohepatitis along with fat with inflammation or varying amount of scarring. I mean, scarring can be noted or in fibrous it can be noted or it may or may not be, because maybe a very little amount of scarring of the hepatocellular. So NAS is a progressive form of NAFLD where inflammation causes liver damage and scarring. So here you can see in pictures the stages of fatty liver from NAFL to grade 1, 2, 3, where grade 3 converts into non-alcoholic steatohepatitis. Grade 4, steatosis and fibrosis can be seen along with inflammation, and that can, if untreated, can be converted into liver cirrhosis or liver cancer. So 2 pathological distinct conditions, NAFL and NASH. So I'm not going into pathophysiology or clinical conditions. So better let's discuss on lifestyle and dietary modification for controlling the NAFL. Risk factor for NAFLD, metabolic syndrome, obesity, where WHR is in men greater than 9 is a risk factor, or obesity, and WHR more than 0.85 for female, where WHR more than 0.5 in female is an indicator of obesity, visceral obesity, hypertension, diabetes, dyslipidemia. These may be because of a sedentary lifestyle. Basically, these are the metabolic syndrome, which is basically responsible because of our dietary habits, poor lifestyle and all. So hormonal disbalances, hypothyroidism, hypopituitarism, hypogonadism, PCOS. That leads to insulin resistance, metabolic syndrome, dyslipidemia, central obesity, and other metabolic related metabolic syndrome and complications like obstructive sleep apnea and weight. So you can see the normal liver, NFLD, fatty liver grade 1, grade 2, and then third picture indicates the steatosis in hepatocellulars along with inflammation, and third stage is cirrhosis. So what is the pathogenesis or lifestyle responsible for the NAFLD? High calorie diet. High calorie diet considered of lots of packed and this preserved food which is more dense in calorie and carbohydrate. Simple carbohydrate, basically high saturated fat, high fructose, and it contains the refined carbohydrate, Western diet and lifestyle, which is basically a composition of unhealthy sedentary behavior of eating pattern and sleeping pattern. Have all been associated with weight gain and obesity, insulin resistance, more of metabolic syndromes like hypertension, and heavier the hip waist ratio, higher the hip waist ratio, more of NAFLD prone. Nutritional management for non-alcoholic fatty liver disease. Carbohydrate should not be more than 50%, which should consist of complex in nature like salad, chilke wali dale, and more of vegetable. 8 to 9 servings of fruits and vegetables should be considered, that should be eaten in the form of complex carbohydrate. Soluble in insoluble fiber, total dietary fiber up to 30 to 40 gram per day. At least this much of carbohydrate fiber should be taken in diet daily. Less of refined flour, less of sugar, syrups, and juices. More of protein. 20 to 25% of total calories should consist of quality protein, high biological value, and high biological value and bioavailability, which considered high quality of amino acid in the diet and in the meal. Branch and amino acid, which considered of more of vegetable protein. Fat. Should our daily diet consider should not less than 20% of total fat, visible and invisible. More of omega-3 and 6 fatty acids, require high PUFA and MUFA. Soluble fiber are coming from the cereals, whole wheat bread, lentil, fruits, mainly apple, avocado, strawberries, different kind of berries and nuts can be added in the diet. And soluble fiber comes basically from whole grains, whole cereals and millets, oats, beans, figs, prunes, and sweet potatoes. That contains lots of fiber in diet. Energy. So these are the examples of simple carbohydrate as well as complex carbohydrate. So we should eat variety of vegetables, fruits, whole grains, seeds, nuts, and beans that contains quality carbohydrate, which are helpful in reducing the body weight and absorption of this carbohydrate, simple carbohydrate, which slows the carbohydrate absorption in the blood. Protective factor, no or light alcohol intake. Basically, alcohol need to be abstinent. Big no to alcohol. Coffee drinking and green tea can enhance fatty liver, enhance in reducing the fatty liver disease. PUFA, MUFA, fish oil, walnut, salmon, safflower need to be added. Mustard oil is the better form of this MUFA. Low glycemic foods, oats, soya, whole grains, cereals, millets, and whole pulses need to be added in diet. Soya protein and whey protein. Fat-free whey protein or milk protein can be added. Dietary fiber in form of lots of vegetable and salads. Antioxidant rich food. Antioxidant, we should eat more of variety of fruits and vegetable and more variety of colorful our plate should be basically of colorful, consist of colorful diet. Vitamin E helps in reducing this inflammation of the liver. This is published in Journal of Hepatology 2018. Reduces hepatotoxicity, stress damage, reduces hepatic inflammation, reduces hepatic fibrosis. So we should eat vitamin D in form of diet. It comes from the olives, walnuts, sunflower, papaya seeds, different type of pumpkin seeds, and black pepper, bell peppers, and almonds. Do's and don'ts. So what we should need to reduce or escape us from the fatty liver disease and NAFLD. So do's are more of vegetables. We should add more of colors of vegetable and fruit, at least 5 serving in our diet daily. Whole grains, half of daily grains intake should be from whole. It should contain husk. It should not remove the chilka and husk from the diet. Fruits 2 to 4 serving per day. Nuts 4 serving per day. Fat-free milk, yogurt, and paneer can be added. Legumes 4 serving per week. Low dairy fat, and again don'ts. Fast food should be totally avoided. Empty calories, cakes, cookies, creams, candies need to be avoided. Potato chips, sugar syrups, and other sweeteners like fruit juices and all should be avoided. Lifestyle and dietary approaches to NAFLD. Energy restriction. Whatever we are taking should be in form of complex carbohydrate, and total weight should be from as per height, the total weight should be 3 to 7% less than the ideal body weight. Even leanness has been reported. Whosoever persons are lean or according to their height and weight, their body weight is according to their height and weight, they also have the leanness. So 3 to 7% of their total weight should be less than their ideal body weight. Long-term maintenance approach, combining physical activity according to the principle of cognitive behavioral treatment. At least 3 to 5% weight loss achieved by hypocaloric diet without exercise generally reduces hepatosteosis, and 10% weight loss may be needed to improve necrotizing inflammation. Fructose intake should be totally avoided in form of fruit juices. Basically, alcohol intake should be totally big no to alcohol intake. Coffee drinking need to no liver related limitations but can be added. With fat-free milk also. Increase exercise, 150 minutes per week exercise or daily exercise can be brisk walking or other cycling, jogging, swimming can be performed daily 30 minutes, and you can say that 10,000 steps per day need to be performed as a physical activity. Included self-monitoring, setting weight loss goals, addressing behavior to changes. Strategies need to be performed or need to be followed. Take home message, maintain hydration, have quality sleep, cut down carbohydrate, alcohol, tobacco consumption, manage stress with regular meditation and sleep, increase physical activity, slow and chew more of eat, give more time to your plate, chew slowly and eat slowly so that you may consume less of the food. Plant-based high fiber food, whole grains, vegetables, legumes, beans and fruit need to be included more of in your diet. Less refined sugar. Avoid highly processed food, packed food or marketed packed food need to avoid it. Avoid heating food in plastics. Avoid food coloring, preservatives, etc. Summary. Lifestyle intervention aimed to weight loss and increased activity are initially for all patients. Feature to the metabolic syndrome and cardiovascular risk factors are very common in NAFLD. So all patients should be screened for these and need to be managed aggressively. Patients should be encouraged to eat healthy, less of refined flour, less of saturated fatty acids, more of fiber, more of whole grains, more of fruits and vegetables. Exercise regularly 5 days a week is mainly recommended 7 to 7 week a day is more good for reducing the weight, active and positive thinking towards life. Thank you very much. Thank you, patient listening. Any question, please?